Hello friends, so we are back with a new topic and today's topic is pulpectomy. According to Finn, pulpectomy is the removal of pulpal tissue from the coronal as well as a radicular portion of the tooth. This also comes under non-vital pulp therapy. Coming to the objectives, the main aim of the pulpectomy is to maintain the tooth free of infection, to biomechanically cleanse and obturate the root canal, promote the physiological root resorption of the tooth, and hold space for the unerupted permanent tooth. The main aim is to preserve the tooth in the arch. Coming to the indication of pulpectomy, it should be done in those cases in which there is uncontrolled hemorrhage during pulpotomy procedure, where the bleeding doesn't stop after applying pressure also, in which the pulp is necrotic, and in case of pulpless primary tooth. Coming to the contraindication of pulpectomy, it should not be done in those cases where the tooth is mobile or tooth is having periodontal disease, or if there is a communication between the roof chamber and the furcation, and if there is insufficient tooth structure to isolate the tooth by rubber dam. So pulpectomy can be single visit or the multiple visit. Single visit pulpectomy is done in those cases where the tooth is or where the pulp is exposed during pulpotomy procedure and it is the on-spot decision taken during the pulpotomy procedure and the tooth is without the periapical changes. So first isolation of the tooth is done and local anesthesia is administered. Then excess cavity is prepared and then deroof the pulp chamber, remove all the pulpal tissue and remove the radicular pulp with the help of broach and completely prepare the canal. Then irrigate the canal and the radiograph should be taken. After taking radiograph, the filing should be done after taking the working length, and then irrigate the canal with the help of saline and then dry the canal and then finally obturate the canal. These all procedure should be done in a single visit in a single day. Coming to the multiple visit, in multiple visit given by Courson 1992, multiple visit pulpectomy should be done in those cases where the tooth is involved and where the tooth is having infection, there will be formation of sinus and abscess, and in case of non-vital primary tooth. So in the first appointment, the procedure will be same, isolation of the tooth is done and then the local anesthesia is administered. And then there will be preparation of excess cavity and there will be deroofing of the pulp chamber and then the formocresol is placed and the temporary should be done. After 5 to 7 days, reopen the canal and then remove the formocresol containing cotton and then biomechanical preparation is done. Take the working length, irrigate the canal, dry the canal, then place the proper medicament in the canal and then temporary restoration should be done. After 5 to 7 days in third appointment, then we will again open the canal, we will irrigate the canal and obturate the canal and then the final restoration or the crown is placed and recall should be done to check the success of the pulpectomy procedure. So there are various material used in pulpectomy like iodoform paste should be used, calcium hydroxide can be used, endoflash which is the newly material which can be used nowadays, and then the pulpotec and then the calon paste and the zinc oxide ozonated oil, and then the recent ayurvedic material like aloe vera etc. can be used. So this was all about pulpectomy. In the next seminar I will be discussing about the apexification procedure. Thank you.